So let's start with the gram-negative bacteria. Gram-negative bacteria, again, as we said, we divided into cocci and bacilli. The gram-negative cocci, only one is there. That is Neisseria meningitis and Neisseria gonococcus. Okay, so this is the only cocci we have here. So if whatever you have to read question nicely. Sometimes when I was writing FMG, the question came, it was a clinical scenario and they gave long clinical feature. The patient have features of meningitis, this and that, and in the end they specify which gram negative cocci will be responsible, and the only option was Neisseria there. So if you know the gram negative where cocci is only one is there, Neisseria, so that is done. Now bacteria, this bacilli or more is there. So how to remember bacilli? Actually bacilli as gram-negative bacilli are 5 types. So how I remember, that is what I am going to tell you. So I divided into 5 groups, 1, 2, 3, 4 and 5. How I remember, the first is their comma shape. The second is spiral shape. And the third is they are short, chota hai, short, chota in height. Fourth is they are straight, and fifth is they are not following fifth is not following all these 3, so they are atypical. Now how I remember this? These are the shapes. So on the basis of shapes, how I remember this comma shapes, they are very important persons. This spirochetes is like a belt, BLT. These are the mnemonic. The short number third, the short, they are short. So they are short in what? Height. How I remember, they are short in height. So by birth their height is short. So this is B square. Straight. How I remember straight? The people who are very straight, they straightforward go to girl and they kiss them. So they go straight and kiss. How I remember atypical? Atypical, just I remember there is no mnemonic. They are MRC. Okay, they are just MRC, MRP, MRC. This is just mnemonic. Every person have their different way to remember. So I remember like this. Maybe it will be helpful. Now let's do it with the name gram-negative bacilli. So first are they are comma shape. Second is they are spiral, spring-like, spirochetes. Third is they are short in height. Fourth is they are straight. Fifth is they are atypical. They don't follow anything. So here is VP, Vibrio cholera and Pseudomonas. Spirochetes, they are belt. That is Borrelia. Leptospira and Treponema. Okay, Treponema, they are spirals. They called as spirochetes. They are spirochetes. And they have some difference also. Let's do it here only. This Treponema, they are spiral. All are spiral. But this Treponema, they are spiral, and their ends is fixed with fixed end. While leptospira, this is spiral, but their ends are hooked end. While Borrelia is spiral, but they are irregular, so irregular spiral. So these are the difference. While shorts, I told you shorts, they are by birth, they are shorts. So heights are short by birth. Two B's are there. So B, one more B is there. H for hemophilus. B, first B is Bordetella and Brucella. Okay, just for small, it cause meningitis, it cause proteosis, it cause pyrexia of unknown origin. Straight, these people are straight, they go straight and they kiss to whom they like girl, they start directly go and kiss. This is the way just to remember, how to remember. K for Klebsiella. E for E. coli. First S for Salmonella. Another S for Shigella. While these are MRC. What is MRC here? M for mycoplasma. R for rickettsia and C for chlamydia. So like this, how I remember. See, these are straight. Like if somebody's ask you which one is straight cocci, which is spiral cocci, which is coma shaped cocci. These are not cocci. These are bacilli. So if somebody asks you like coma shaped bacilli, like spiral shaped bacilli, so you, by this classification, you can understand what you are studying. You are studying gram negative or gram positive. For everything, you should know the classification first. Now I will show you, my handwriting may be bad, so I will show you like gram negatives. These are cocci, these are bacilli. Cocci are Neisseria, meningitis and gonococcus. It causes meningitis, with the name only you understand it causes urethral infection. While bacilli, they are coma shaped, they are spiral, they are short, they are straight, they are atypical. Coma shapes are very important persons, while spirals are belt. While shorts are, they are short in height by birth. While straight they go straight and they kiss. While typical is MRC. V for vibrocolera, P for Pseudomonas. While Borrelia, Leptospira and Treponema. While HB square is Haemophilus, Bordetella and Brucella. While KESS case is Klebsiella, E. coli, Salmonella and Shigella. While atypical is MRC, Mycoplasma, Rickettsia and Chlamydia. Now you have to study everything gram negative and gram positive bacteria one by one separately. We will do it later on in separate. Thank you.